Hi, Dr. Cindy Hodgson here from Essential Therapies in Sylvania, Ohio. I'm a physical therapist, exercise physiologist, and expert level John F. Barnes myofascial release therapist. Anyway, tonight we are here to talk about some self-care that you can do at home. So I very often prescribe this for some of my patients who are experiencing tightness on one side of their body, okay? Clinically, we may call it an upslip of the pelvis, but it may or may not be that. So sometimes we just have, either it's a work thing that we do, of course right now work has changed and things are at home, but it might be some posture, it might be the way that we sleep that creates tightness on one side of the body or the other. So it's a very common thing and we can treat it every day at home to keep it from getting out of hand. So we actually found this a little bit ago. I'm Cassie. So I'm going to go through how you can do this at home. It's not rocket science. I can help you out with this. And then you can have a treatment to do on your own every day to keep it under control. Especially if a therapist that you've seen already has told you that you have an upslip on one side or you just can feel the tightness yourself, this is how you take care of it. So Cassie, I'm going to have you stand up right here in front of the fire. So I decided not to use the table because most of you don't have a table at home. So you really don't need one. But first you're going to take a look at the person, and you might even do this to yourself standing in front of a mirror and know this. You might have your hands on your waist and be able to tell that one side feels tighter than the other or is higher than the other. But I'm going to take a look at Cassie here. I'm going to simply put my hands on top of her pelvis, which oftentimes people call this the top of the hips, right? So you can just bring your hands in underneath the rib cage. Sometimes people are ticklish. You're doing pretty good there, Cass. So now I have my hands on top of her pelvis, and a little bit ago when we looked at this, see, I shouldn't have done that leg pull on you because it's helped it a little bit. Earlier she was even higher on this left side. The left side is a little higher. And I'm going to have you, Cassie, put your hands on your hips. Can you tell if one side is higher than the other still, or does it feel better than it did?
It feels better.
Is the left side still a little tiny bit higher?
Yeah.
Yeah, okay. So when she first did this a little bit ago, she could really feel that hand was up high, okay? So I look in the front, and then you can have them turn around, and you're going to look in the back. So you can do the same thing, take the hands on top of the pelvis. Now, it might be confusing. If it looks different back here, then you don't really have, a full upslip. You may have a rotation going on. But so she was higher on the left in front. If I look back here and she's higher on the left again, and she is just a little bit, you can also take your fingers on the little dimples that we have above the sacrum here. And oftentimes you can put your thumbs there and you can see, and she is still a little bit high on that left side. And then you can look at your thumbs and see if the one side is higher than the other, okay? So looking at her right now, go ahead and turn around. This whole side of her pelvis is higher than that side. So go ahead and exaggerate it for me, Cassie. Go ahead and lift that side up. Yeah, so that's kind of how she feels, okay? So the next thing I'm going to do is have you lay down on the floor here in front of me. And we're lucky we have this nice soft, so let me see, let's have you move with your head over that way a little bit more. Yeah. The soft shiatsu mat, which is nice to get on the floor, but you can also do this on the bed. So especially if you can't bend over well or get on the floor easily, you can always have someone get on the bed. So I'm going to have you bend your knees, go ahead and lift your bottom up, and then lower it back down. So this just kind of aligns the spine to make sure that she's not moved over on one side more, especially when we're looking at this. And then that's good. Okay, so straighten out the legs, and I'm just going to lift up the back of her ankles, and I'm going to relax my arms, and I'm not grabbing her and pulling her or anything right now. I'm just lifting up and letting those legs fall into my hands, okay? I'm going to lower it back down, so I'm going to a little tiny bit of a tug just to make sure things are straight. And now I'm going to take my thumbs just under the ankle bone. So if you start your thumbs up high, mid-calf, come down, come down, come down. You'll feel a bump right there. You go over that ankle bone and put the thumb right underneath that ankle bone. Now bring the ankles together, and sure enough, her left leg is short. So my right thumb, her left leg is up higher towards her head than my left thumb is, okay? So that means this leg appears short, right? So this leg here, left leg, the foot ends up here, this right foot ends down here. So this leg appears to be short, but the bones are not really short. It's just that we saw the pelvis is being pulled up on that left side somewhere. So now I'm gonna go ahead and feel this. Now I could do a leg pull here, and that's what happened. That's why she's a little bit better. We were practicing earlier or taking a look at her alignment. She started to release already, but this is for you to fix that upslip. So I'm going to show you something else, another technique that if you have someone else there who's willing to work with you, they can do this. So, oh, and incidentally, this technique can be used if you were to do it on both sides. It's totally fine too. It feels great. It's a wonderful technique. So, okay, Cassie, I'm going to have you come up now. We're going to open up her left side. So this is all about setting her up the right way. So I'm going to take pillow for her head, and what I'm going to do is place a bigger pillow underneath her waist on the right, because she's going to be on her side, because I want to open up that left side. Okay, so go ahead and sit up here, Cassie. I'm going to put this underneath your waist. So go ahead and lie down, and you're going to roll on your side facing that way. Okay, so we're going to make sure that you're on that pillow and it's in the small of her waist. Now, this is lifting up this side, the right side of the pelvis. I like to think of it as, and I describe it this way to patients, like you're laying like a banana over a pillow, okay? So can you tell that that's up a little bit?
Yeah.
Okay, so it feels like this is already stretching out a little bit right here between the rib cage and the pelvis. So what we're trying to do is open this space and lengthen this leg down. Now, a couple more things we can do. If it's comfortable for them, they can let this arm lay over here and just let them know that you can relax it. It doesn't have to be stiff, but that is right there pulling into the fascial system down into the rib cage, and it's giving just a slight tug right here, which is good. It's starting this release for us already. Now, if she has no one else to help her do this release, she can lay like this. This is already starting to open the elastic components, and then as we stay here longer, she may start to get a myofascial release here. So the top leg, I'm going to let it come down, and when I took it off of the other leg, it pulled her pelvis down a little bit more. So I'm going to exaggerate a little bit. It went as the leg fell down, it opens this up. See how that goes? Now, is that comfortable though for you?
Yes.
Okay, but she's pretty limber, right? So someone else, it might not be so comfortable. So you can always take another pillow and put it underneath that leg. So in the studio, we will take a yoga bolster and put it under here so that the leg is even, because then we're going to be pulling the leg and getting more direct contact. So the next thing you're going to do is come over here. If you have someone to work on you, obviously, is the classic basic myofascial release is a cross hand technique, okay? So you cross your arms over, and you're just gonna put your hands right here on the person. Now, right now I'm on top of clothes, but really you wanna do this on top of skin. So I'm gonna put my hand on her rib cage, and right there is where it feels tight, I can tell already. And then I would put my hand underneath to get on her skin on top of her pelvis, okay? So I'm gonna put my hands here, they're real close together, and then I'm softening down toward the floor into her tissue. Kind of think of it as like you were just going to press your hand into clay and make an indentation there. And then you spread the hands apart. So where they've crossed, my pressure is just gently separating them. So I'm gonna stay here for as long as I comfortably can. If you're not used to doing this work, being in one position for a while, it can be tiring, okay? So from here, I would stay at least 5 minutes. But whatever you can do is still gonna be helpful, because we need that amount of time to change the collagen, which is what usually sets up a myofascial restriction. But maybe you're just tight and you don't have a restriction there yet. It's just the elastic component. So just laying here like this might be enough. If it's not enough, then you might need some help, or you might need to be here much longer. So now as I'm settling in here, do you feel that, honey, in your pelvis?
Yeah.
Can you describe it at all, or?
Not really.
Not really? That's okay. So it's starting to soften more so in her pelvis. So the rib cage is a little tighter. So I would stay here, like I said, at least between 5 and 10 minutes. I may end up changing position and do both hands on the rib cage if I felt like that was still tight after that time, and then I would shift my focus. Or you could put both hands on the pelvis and shift focus here. The last thing that you could do, if you had someone to assist you at home, in this position, just go ahead and take up the leg, and you can just do it sitting here. I'm just leaning my body. So I'm grabbing her leg, so I've got her ankle resting on my knee, and I'm gently engaging her leg. I'm connecting with her leg and holding it, and then I lean back. So I'm not muscling it with my arms. I'm not trying to pull her away. I'm just connecting and leaning my body weight into it. This way I'm not muscling it. It's very easy for me to do. Actually feels really good, and I am able to set myself up. So I'm kind of working on myself as I'm treating, getting my body in positions that help to stretch and lengthen. So here, with her arm overhead and being over the pillow and me pulling her leg, we're really opening up that left side of her body. Can you see that? How's that feel, Cassie?
Good.
Good. Do you feel it in any particular area?
Like down my leg.
Down your leg? Okay. Down like the lower leg or the upper leg?
Upper.
Upper leg, yeah. And that's kind of where I feel it too. It kind of gets stuck thigh into the hip. So we should work on this more tomorrow. And that's what this hiatus, I suppose, has been good for, is, you know, things that we haven't been used to doing. We have time to do them now, which is great. I never get to work on my kids, it seems like, and so it's a good time. But it's also a really good time to work on your own body. So especially if you've been told or you know that you have an upslip on one side, really focus on that side. But you can do this on both sides. It feels really good. In fact, if you want to spend some nice quality time with your family member, just give it a try. And you don't have to be in each position 5 minutes. Try 3 minutes on each side and just see how that lengthens you and helps you feel more balanced. Okay, so we're not staying here as long as I would, like I said, but let's take a look at what that looks like now. Cassie, let's go ahead and take this pillow out from under you. Let's ditch this pillow. Okay, so there. Go ahead and lift your bottom up, lower down, nice little bridge there, that's good. Okay, I'm gonna pull the legs. And they're even. Does that feel different to you already?
Yeah.
Yeah. And I'm just gonna look at it here. She looks even. Okay, go ahead and stand up. Let's take a look at it one more time. And boy, that looks better. Feel better? Yeah. Okay, turn around. Make one more check. Yes. Okay. Now we could look up here too, but that's another video for another day. Come on, sit down. So hopefully that will help you with the home correction of an upslip in the pelvis or just tightness on one side of the body. Thanks for watching. Please comment and share if it was helpful. Have a great day.